हरिओम दोस्तों, क्या आपको अक्सर सर दर्द की कंप्लेन रहती है? आंखों के इस एरिया में या फिर टेम्पोरल बोन के पास आपको दर्द का बना रहता है? रनी नोज, स्टफी नोज, हमेशा नाक से पानी बहना या आपका नेजल कॉन्जेशन, नाक ब्लॉक रहना और मॉनसून आते ही छींके तो मानो सुबह उठते रुकती ही नहीं है। क्या आप इन सारी प्रॉब्लमों से पीड़ित है या फिर कभी सुंदर सा फूल देखे और थोड़ा सा महक लेने का मन किया और छींके आने लगे? आपको डस्ट एलर्जी, पोलन एलर्जी, विनविनेटिस जैसे प्रॉब्लम से आप पीड़ित है और आप सोच रहे होंगे अरे मेरी ये प्रॉब्लम्स कैसे जाएंगे, मैं क्या करूं? या फिर आपको समझ ही नहीं आ रहा है कि ये आपके शरीर को किसी न किसी तकलीफ की वजह से हो रही है। तो चलिए दोस्तों, इस सारे सवालों का जवाब मिलेगा आज इस एपिसोड में। आज हम लेके आए हैं एपिसोड ऑन साइनस और इसके लिए हम आमंत्रित करेंगे हमारे शो पे डॉक्टर शंकर चक्रवर्ती, मेडिकल सुपरिटेंडेंट, अगरतला गवर्नमेंट मेडिकल कॉलेज। वेलकम डॉक्टर टू आवर शो।
थैंक यू, नमस्कार।
Our topic is sinus and its associated diseases. दोस्तों, साइनस से तो बहुत जन पीड़ित होते हैं, पर क्या करना चाहिए, क्या नहीं करना चाहिए, तो ये सब के बारे में आज हम जानेंगे सर के साथ इस पॉडकास्ट में। तो स्टे ट्यून्ड, watch the full video to know all the details about sinusitis. Sir, so we'd like to ask on behalf of audience, what is sinus?
Actually, all of us know about nose. Nose, in the surrounding of the nose, there are some air spaces. We call it sinuses or paranasal sinuses. Because it is surrounding the nose, that's why we call it paranasal. 4 pairs of sinuses are there. One is sphenoid sinus. This, most of the people don't know about this one, this paranasal sinus, because its location is little bit difficult or different. And next is frontal sinuses. Both sides, just above the eyes. Then ethmoidal sinuses, that also nearby eyes, both sides. Then maxillary sinuses. This is the biggest one we know about this one. Any inflammation of this space, we call it sinusitis. Commonly we call it sinusitis. And this sinusitis almost always accompanied by rhinitis, that is inflammation of the nose. As I told you earlier, that is paranasal sinuses. This usually both the inflammation goes hands to hands. So this is the common thing. There are lots of inflammation can occur because of various causes.
So major causes, what would be the?
It may be infective cause. That infective again you can divide in many, like viral infection, bacterial infection,
any antigen coming from outside,
fungal infection. That is infective cause. Then some, as you told, some allergic cause may be there because of some allergen. There may be sinusitis. Some other, because of some other disease that is secondary to some other disease, there may be sinusitis. See, the area, it is closely related with the oral cavity and the facial bone and the throat also. So any infection of this area can lead to sinus infection also, sinusitis also. But the most common is allergic and infective. These are the common.
Means rhinitis and sinusitis go hand in hand.
Rhinitis, inflammation of nose is rhinitis. And once rhinitis is there, there is high chance of sinus infection. So that combinedly we call it rhinosinusitis. When it is for short period, then we call it acute rhinosinusitis. And if it lingers, then we call it
Chronic.
chronic rhinosinusitis. See,
Sir, who are the most prone people, who are most prone, or I should say, who are more prone to this sort of disorders or diseases? Which age group particularly?
age group, any age group,
Any age group.
But more common in Middle East people, here is more common, but it can occur in the children also. It can occur very old age also. Any age it can occur at any age of people.
Any certain conditions, sir, which makes people more predisposed to this sort of problems, respiratory illnesses?
Basically, see, entry of air in our body, the nose is the main,
Yes, sir.
and next is oral cavity. These two are the main area. We use both the path for our respiration.
Mainly nose.
But the through nose respiration is more safe,
Yes, sir.
because there is a mechanism for filtration of the air. Whatever dust and other particles comes, it gets filtrated and get in. That's why, and there is humidification mechanism also in the nasal cavity. So the temperature what you need, the temperature of the inhaled air you need, that is also modified in our nasal cavity.
Yes.
So it is more safe. But if we breathe through our mouth, in that case, it is not that much safe. This mechanism, filtration mechanism,
Cilia is not there.
and, filtration mechanism and humidification mechanism, these are not that much active in this route.
When we inhale through oral
In this route is not that much. So it is safe to breathe through
always
nose.
through nose.
Through nose. Now, see, nose also is a very, very difficult area. One area is there, what we call osteomeatal complex. This is a very tough area because of, you see,
So why it is so? Why?
Normally, we see people having very good shaped nose from the outside, straightforward nose, very good nose. But if you see internally, there might be some deviation of the nasal septum. That is the partition of the nasal cavity, which makes two nasal cavities, two nostrils, because of one partition. That partition we call nasal septum. Externally, if you look to someone, you will find that, it's very beautiful nose, it is straight. But if you go inside, by naked eye also you can see, by some method you used to see through headlight, head mirror, or some other light source using endoscope or all these things, we may find that there may be some deviation of the nasal septum. This is the first one. And because of deviation, you see in the lateral wall of the nose, in the both side of the nose, there are three bones, small bones. We call it turbinate, superior, inferior, and medial turbinate. Inferior turbinate is little bit bigger than other two turbinates. See, the septum and in the lateral wall, and in the lateral wall, three turbinates, and between the area that we call the nasal cavity, and it has got roof, floor, walls, all these things.
Yes.
So it has a diameter through which the inhaled air goes inside. If any modification in the anatomy, if any defect in the anatomy of this area, as such this area is a very small area, and again if there is any anatomical deformity in this area, so you imagine what will happen.
The amount of
air first will reduce. Another thing, if the septum is deviated in one side, so that in the side of deviation, there will be narrowing of the nostril,
Passage.
nasal passage,
Mhm.
but in the opposite side, the
Wider.
area where it is convex,
Mhm.
where it is concave.
Mhm.
The convexity area will be narrowed,
Mhm.
and concave area there will be
Bigger.
widening of the nasal cavity.
Yes.
So what happens in that case? The terminates I told you, the superior, middle, and inferior
Inferior.
terminate. These terminate will get enough space to grow up, and they will grow more than the normal growth.
Normal. But
So
it's-
we call it hypertrophy of the terminates. So another interesting thing, the nose, whatever we see, it is made up of in the frontal, one side it is cartilage,
Cartilage,
and
yes.
another side this is
Bony.
bone. So the defect in the bony area and defect in the cartilaginous area, that also another factor
Another problem.
which causes the area more complicated for air disease. This is one structural or anatomical reason. The people, whatever age group it may be, maybe childhood, elderly, or adult or geriatric group of people, whatever it may be, if anyone have this kind of anatomical deformity, they are more prone to have such type of disease. Because I told you to start with, I told you that these sinuses, these are air-filled area.
Hollow
These are
spaces.
hollow spaces lined by the mucosa.
Mucosa.
Mucosa, and it is air-filled area.
Yes.
So, and one more thing, there is one thing through nose, that there is connection with the eye.
Yes, sir.
There is connection with the eye. And again through nose, there is connection with the ear and
Mouth
throat.
also.
The throat also. There is connection, what we call Eustachian tube.
Yes, yes.
And here it is lacrimal sac. Lacrimal sac. Sometimes it happens that some pulsed point in the nearby the medial canthus. Medial canthus means the area in between the eye and nose. That is medial canthus. It is because of blockage of that lacrimal
sac.
lacrimal sac or lacrimal duct. There are
So
so
this
many
means
things.
any eye infection may also lead to
Yes,
this problem.
yes, and vice versa also.
Yes, vice versa also.
Vice versa
Yes,
also.
sir.
So this tube should be patent.
Patent.
If there is any deviation or
Deformity
any
or any
deformity,
abnormal
then
changes
also again
there
it
also.
was problem. At the same time, the Eustachian tube, what I told you,
Yes.
the tube connecting nose, throat, and ear.
Ear.
That also, any infection in any of this area, either nose or, and again, all the sinuses are connected with the nose.
Yes.
What we call ostium, ostium of the sinuses, ostium of the sinuses. So any infection directly it will go to sinuses.
Sinuses.
Any infection of the nose it will go to sinuses. Now this is the one part. Then again, as it is the entry of air, whatever in our atmosphere, whatever air we inhale, it carries so many things.
Yes, so many.
So many things.
Pollens, dust.
Dust, pollen, bacteria, virus, fungus, parasite, whatnot.
Everything. And nowadays pollution is so much increasing. Many more suspended carbon materials are also there.
And so many metals.
Yes, the heavy metals also.
So
Yes.
many things.
Many things are
Many
there.
things
Yes.
are there. Now, whatever I told you that there is mechanism to check these particles.
In the filtration part in the
process
nose.
is there.
Yes.
At the same time, temperature
thermal
regulation
temperature
mechanism is
yes.
also there.
Yes.
Still then, some escapes. Now, if any kind of infection, be it bacteria, virus, fungus, once it enters the nose, it can travel any of this area what I told you now, sinuses, throat, ear, whatever, even eye, anywhere.
Even
it
sir,
can
in the
travel.
cranial cavity?
Yes,
Okay.
yes, because the sphenoid sinus, the location of the sphenoid sinus
Is
little
internal.
there. And all these things have got its connectivity to so many parts of our body. through the natural orifices. There are so many natural orifices and they are interconnected. And somewhere it is somewhere it is divided by some membrane or some bone. That bone is very thin. We call it peppery thin bone. A peppery thin bone. And sometimes through some membrane. With very trivial viral, bacterial or any other infection or injury or any inflammation or any trauma, it may get torn, teared, ruptured, whatever we call it. That also again also act as a route of infection or route of entry of the infective agent or allergen or pollen dust or whatever it may be. All this causes the sinusitis. So there are so many things. One is anatomical issue.
Yes.
Another is our nasal mechanism, physiology. That is another issue.
Yes.
Another is environmental issue. All issues are there. And now the internal. There might be in the maxillary sinus there might be some tumor. Maybe benign, maybe malignant, cancerous. They also possess. Some other non-malignant but very dangerous tumor in the nasal sinus cavity, like nasopharyngeal angiophytoma in case of juvenile
in case of
male boys up to the age of 14 years, which is again very dangerous issue. And some people are there, some condition like they are less sensitive or some other things. We even sometimes see some maggots in their nose and all these things. That because of rhinitis, one kind of rhinitis. Some rhinitis we see in that case also.
Maggots inside the nose.
Yeah, inside the nose. So atrophic rhinitis. In that case, the bones of the nose gets atrophied. Earlier I told you it gets chance to grow more than the usual.
Yes.
Here it gets atrophied. It becomes smaller. Also the nasal passage it becomes more wide. Even through the nasal passage or naked eye also you can see the nasopharynx. Nasopharynx also that much wide. So far you can see. You can see in that case also. So in this area, nose and nasal sinuses, anatomy is a very, very important part.
Point.
Once the anatomy is deformed, once the anatomy is defective, in that case
they become more prone
to
these problems.
Diseases.
Sir, does heredity play any role in any children developing sinusitis or sort of respiratory problem in earlier stages?
Yes, it's there. Yes,
If
there.
a father has.
But is there. But it's not that much important. It's there. It's there. It cannot be denied. It's there. And some issues like some polyp. There is polyposis is another factor.
Nasal polyps.
Nasal polyp and nasal fungal infection. Allergic fungal rhinosinusitis. That is also very common and very dangerous issues. And all these infection can go up to the cranial cavity. I told you there are so many natural orifices.
Medical condition.
There are so many natural orifices which connects with the other organ of the body. Brain, orbit, eye, brain, orbit, surrounding area. So what we deal with the ENT, ear, nose and throat, basically the throat and above, all the area we have to deal it. Otherwise, nowadays through endoscopic development of endoscopic surgeries, endoscopic sinus surgery and endoscopic surgery, we can reach up to the brain also. Some pituitary tumor, some skull-base surgeries, all these things nowadays ENT surgeons are doing.
Sir, now as you have talked about some of the treatment options, so I would also ask you that what are the treatment options available if one has sinusitis?
See, we have to find out first the cause of the sinusitis, then extent of the disease, then we have to formulate the treatment modality. Most of the cases with the medical treatment, that is the conservative management, with the medical treatment, it can be cured. It can be cured.
If any polyp or something, tumors as you have said inside, then was invasive treatments.
Yeah, in that case, surgical intervention is required. But in that case also, there is a combination of both surgical and medical treatment sometimes required. Say for polyposis, mainly the ethmoidal polyp and all these things, that might be extensive polyposis. So if you go for surgery also, then it is very difficult. So initially sometimes we reduce the size, number of the polyp, all these things through medical management. Then we go for surgery, and after surgery also we have to continue the medical management. If my patient fails to continue that one, and once the symptom is free, patient feel that yes, I am okay now, why should I use medicine? Then there is high chance of recurrence of the diseases. There will be recurrence of the diseases, and repeated surgical intervention may require. We have to go for revision surgery and all these things.
Sir, one most important question that my audience would like to ask, that when people should, a common man, how to understand when I should visit the doctor, like ENT specialist like sir, when they can come to your clinic, or for any medical help, they can seek for medical help. What are the common signs and symptoms they should look for in their body so that they can understand now I need to have to go to the doctor?
See, nose is nose or ear or oral cavity or throat. This such area, whenever someone feels some problem, he or she has to come to the
immediately
doctor. And doctor, no, that her his or her symptoms will compel him or her to come to doctor. But the thing is that where they will go. Most of the time, people doesn't consider ENT specialist or ENT surgeon to visit. They may think, oh, I am having some running nose, I should go to a physician. Sometimes oh, I am having some change in test, or some problem while swallowing, some problem while breathing, all these things. They may visit respiratory medicine people or general medicine people, but they have to visit to a doctor. It is the duty of the general practitioners or the specialist in any field. Once they find that it is a problem related to ENT, because I told you to start with that it is a very difficult area, very tough area for everyone.
And right from critical also.
Right from anatomy to physiology, everything is critical of this area. So this area should be treated by the experts of that subject. So commonly when people comes, one area is epistaxis, means bleeding from the nose. In that case, every people they used to come to the ENT surgeon if it is available nearby. If it is not, if they are not available nearby, they may visit to the
general physician. But
or
they must seek
practitioner.
medical
But
help.
It is the only one field when people used to search for ENT surgeon. They knows that yes, is bleeding. Sometimes another common is nasal blockage or nasal obstruction. In that case, also they visit. Sometimes, in case of children, we have encountered so many times, some foreign body nose, foreign body ear, even foreign body throat. In that case also they visit ENT surgeon. Then
sometimes the children swallow something by mistake.
That is foreign body. That is foreign body. Everywhere it is accidental. The children playing with something, they used to put it inside the nose.
And the mother may not be knowing what is going on.
My mother may not be knowing, or even knowing also. Sometimes some people used to take it out, try to take it out. In that case, they again push it back to make it more complicated. Yes. See, the area, everyone of us will know. If we push it again further interior, then what will happen? This is the area through which we inhale, through which we get the oxygen, and our circulation, our lives continues. If we block it, what danger may happen? It is very dangerous thing. So it should not be handled by a person who is not expert in this field. These are the common things normally people come to us.
Sir, one last question that I'd like to ask. Sir, now we know what very beautifully sir has explained what is sinusitis, what are the symptoms, diseases, and common, what are the anatomy, physiology of everything. Sir, now people would want to know how they can prevent it. If is it anything in their hand they can do in their lifestyle changes or any food habits particularly, anything they can do so that they can reduce the chance of recurrence along with medications if anyone is suffering. Anything at
one most important thing during COVID we have learned, that is use of mask. That is a very important thing. It's not for, though we learned it during COVID, earlier we surgeons used to use it while doing surgeries, but it was not that much popular to the people. Even not only people, it was not even popular in our doctors also. But COVID taught us these things. This is very important to avoid any kind of respiratory illness. This is very useful one. This should be
when we go outside, so basically.
Whenever we are outside our home, we should use it. It is not that while examining patient or for other reason we should use it. It's not like that. When we go outside our home, we can use it. It will help us a lot. Number one. Number two, smoking and all these things one should avoid.
Alcohol, smoking,
smoking, chewing, betel nut, tobacco, all these things. Because one thing I did not mention, because cancer of this area also is very important one. Our throat cancer, oral cancer, then nose and paranasal cancers, all are very good contributor of mortality and morbidity in the common people group. That can be avoided if we avoid all these things. Another thing, everyone should avoid the known allergies. Sometimes if you know that if I go for such type of work or if I consume such type of food, I feel uneasy or there are some changes, so I should avoid it. Because allergy plays a big role in sinonasal diseases. I mean nose and paranasal diseases, what we call sinonasal diseases. They should avoid it.
So, example, sir, I could relate to my personal life. I am allergic to brinjal. Whenever I take brinjal, I feel that something is irritating in my mouth or throat cavity, or maybe I have a more chance of getting infected by cough and cold. So I always try to eliminate this brinjal and it's
definitely
from my diet.
Treatment of allergies to avoid that allergy.
Yes.
Because sensitization to any allergen is very tough job. So it is better to avoid that.
Avoid this.
Mostly allergy occurs due to some protein or like that. But sometimes some vegetables, some pollen, some dust also causes allergy. If you know, then we can avoid it.
It's best to know the foods that are causing the trigger and eliminate them from.
Another important thing is temperature. What temperature I cannot tolerate, that I should avoid.
Yes,
someone cannot take freezed
water
food,
bottle, freeze, thanda pani,
soft drinks, ice cream, all these things. They should avoid. Who cannot tolerate it, they should avoid it. One most important thing is that,
and mostly, sir, it is also seen that the people who are already having sinusitis, asthma, or respiratory related diseases, they are always more susceptible to cold also. So they should, in general, avoid those things and take some warm soups instead if they want, or normal temperature water.
And another important thing is, most of the people, they used to put fingers or all these things in the
Dirty,
nasal
touching
cavity.
this-
If
yes.
even it is clean also, it should not be, because nasal mucosa is very delicate. If one kind of case of children, some very important cause of epistaxis, that is bleeding from the nose, is this is nose leaking by finger, what we call epistaxis digitorum.
Maybe the fingernails were
fingernail.
not cut properly.
Another one is, some people used to clean
Earbuds,
through some earbud or some other household articles like matchsticks, some so many
Clips
things,
were
so many,
clipped that
even
way,
feather, some feather
Yes,
also
yes.
they used to use in the village level. So many things. These are again very dangerous. Particularly state like Tripura, where there is most of the time it is humid. There is possibility of fungal infection. Using all these things can means inviting fungal infection.
More diseases.
Yeah,
yes,
fungal infection is very important here. Infection. So we should avoid all these things. And number 4 is, whenever you feel any problem, be it nasal blockage, be it running nose, be it excessive sneezing, be it earache, or difficulty in swallowing, or any ulceration or burning sensation, or any problem with the oral cavity, we should visit a doctor, if possible ENT surgeon specialist.
Yes.
If it's not available nearby, we can visit doctor also. They will suggest where to go. In any district level, in our state, though, almost in every district level hospital we have got ENT specialist. In some subdivision level hospital also we have got it. So in our state it's not a big issue. We have all these things. In this way we can keep ourselves, at least ENT health is better.
At least we can manage our health, and those who are having symptoms, at least they following all the protocols that said by sir, you can at least prevent. And if you are having the acute symptoms also, or even chronic, you can at least manage those with the help of specialists, but don't do self-medication.
Exactly. It's very dangerous thing. It's not for only for ENT
But
issue, but for every issue.
yeah.
Self-medication is very
Every
dangerous.
modality it should
Very
be
dangerous.
followed. Sir, one of my personal interest question, sir, do you think breathing exercises, doing some pranayama or basic breathing exercises, even as simple as deep inhalations and exhalation, having some mindful eating during taking meal, will help in managing those symptoms, those who are suffering, or maybe in prevention?
Definitely. Definitely. See, this yoga, pranayam, breathing exercise, or any other exercise.
Any good diet and
everything,
lifestyle.
Good diet, lifestyle, all these things will make you fit. Will make you. It's not alternative of any treatment, but it is a very good modality. It is a very good way to keep yourself fit and fine. So once you are fit, you will suffer less from other diseases, the one who is not fit. So it has got definite role in preventing diseases. But once the disease is because of structural deformity, in that case it may not help that way. And one thing everyone should know, that it is not the alternative of treatment. It is the way of healthy life. No, it is a way of a very healthy life. And if you practice this that one, you may not need to visit doctor also in some time. But once you have problem, once you are diagnosed with some disease, you should take treatment for that specific
from the expert.
Expert. At the same time, you have to continue the lifestyle modification things also, like yoga, pranayam, exercise, breathing exercise, working.
Not using alcohol, tobacco, everything.
And see, not for ENT, only for everything. Nowadays, the lifestyle diseases are more than the infective diseases. People most of the people are suffering from what we call now
Diabetes,
NCD. non-communicable disease.
Yes.
That is hypertension, diabetes, cardiac disease, renal
Even
disease,
in female
cancer,
PCOS, is-
cancer, all these things. And everywhere lifestyle is very important to us. If we can prevent, if we want to prevent this thing, then first we have to modify our lifestyle and to lead a healthy life. To lead a healthy life, we need this yoga,
Inculculate
then
this
pranayama
pranayama,
and
massage.
all these
Yes, everything.
things. So it has got definite role.
Yes. Thank you, sir. Thank you so much for this insightful podcast. I hope all of our audience have learned many things from you, and they will definitely take care of their health after watching this podcast.
Thank you to you and all the audiences. Thank you.